So I'm delighted to be here on the second day of this first inaugural ITP Summit. I've been enjoying all of the panels and excited to be here with all of you today. As a field, we have many available and effective prevention, screening, and treatment interventions for psychiatric disorders, yet we struggle with delivering these interventions to the many populations that need them, both in terms of the quality and also the quantity of the interventions. For example, while some people may be able to gain access to a clinician for a single session evaluation, they may live at too great a distance to return for treatment. For others, even access to a single session of face-to-face contact is impossible. One barrier to accessing care is the limited capacity of the system to treat those in need. I would argue that capacity building for our treatment system is an extremely pressing need for technology in treating psychiatric disorders. So, for example, in the field of substance use disorders treatment in the United States, only 10% of those with a diagnosable substance use disorder will receive treatment for their disorder in their lifetime. So in 2015, what did that look like? What that looked like is that 10.8% of the 21.7 million people who needed care in the United States for a substance use disorder received it, representing 19.3 million people who received no care for that disorder. It is remarkable that we have not moved that needle on that statistic over the course of the last 3 decades. Even in the face of the opioid epidemic, we struggle to provide greater access to treatment for many reasons, including the lack of capacity in the system to meet the need. And I use this example of substance use disorders treatment, but it is only one of many examples of critical unmet need, as illustrated yesterday by Scott Rausch in his opening comments for this summit. So there are many barriers to accessing appropriate and effective care for psychiatric disorders. This includes distance to care, as well as a range of social, financial, and cultural barriers that can inhibit or preclude an individual from seeking or gaining access to care. Digital technologies have the potential to transform mental health care, particularly among groups that have traditionally been hard to reach due to lack of access, education, or resources. In addition to general lack of access to care, there is also the lack of access to culturally appropriate care for many populations. And yesterday we heard a talk from Armin Aravian, who talked about co-creating digital innovations for mental wellness and equity and addressing these social determinants of health. And this is a very, I think, promising approach. So in this session that we are now going to embark on with this panel, we're going to hear from leading experts in technology, policy, and public health, and then we'll discuss how we might use these insights to translate them to improvements in care and access to care. We will then have the opportunity to discuss how we may address the gap between the availability of mental health services and the pressing need for such services both in the U.S. and globally. In our session, we're going to hear comments first from Dr. Ken Duckworth, then Dr. Gary Gottlieb, Dr. Oliver Harrison, and Dr. Kim Leary. I'm going to introduce each speaker as they are invited to the podium to speak, and then I'm going to invite our speakers up front here, as we have before, for a discussion and a question and answer session, which I believe is going to be very productive. So with that, let's get started. Our first speaker is Dr. Ken Duckworth. Dr. Duckworth is the Medical Director for Behavioral Health at Blue Cross Blue Shield of Massachusetts. He's an assistant professor of psychiatry at Harvard Medical School. He's the former acting commissioner of mental health for Massachusetts and also is the state medical director. He is also currently the medical director of the National Alliance on Mental Illness. So with that, please welcome Dr. Duckworth.